Good afternoon. This is Friday, July 10th. I'm Gary Pace, the County Public Health Officer, and we're going to give the coronavirus update. The current numbers in California, the cases are a total of 300,000 with 6,800 deaths. We are seeing a significant increase in cases and hospitalizations throughout the region and throughout the state. In the country now, there are approximately 60,000 new cases per day. Lake has also had a large increase lately, now with a total of 108 cases, 25 that are active. 4 people are currently in the hospital. 2 of them are out of the county at a higher level of care, and 2 are in the hospitals in Lake County. Demographic data and data about how we are doing regarding the state reopening plan are all still on the web, are all now on the web page, and they're updated weekly. So if you want to get that information, you can find that there. So what I wanted to talk about today is how the reopening is going. Things are changing rapidly now, and we are really in a new phase. The situation is worsening regionally and statewide with increasing number of cases, and a lot of the people are sicker than they were previously. Testing demand is up, and the labs are quite backed up, so the turnaround time is extended. And we're just having problems accessing medications and different things. The governor is concerned. Now 29 out of the 58 counties in the state are on the governor's watch list, where the numbers have gotten bad enough that they have to start adding more restrictions in those counties. Sonoma County just got put on the list today, and if you're on the list for 3 days, then they start putting these restrictions on. The current restrictions include closing indoor dining, closing indoor areas and brew pubs and wine tasting, closing bars, stopping indoor worship services, and closing indoor movie theaters. Now, Lake County is not on the watch list yet, but with some of our numbers getting higher, we are kind of trying to pay close attention to that. If we can step up our precautions now, we may be able to prevent this from happening and keep all of the businesses open. But we're really starting to recommend not holding large group events now due to these increases in cases, because the risk is that some of these large gatherings may push the infection rate too high, and we will get on the list and have to close some of the businesses. So a lot of what we're seeing is that the spread seems to be happening in indoor groups. So in our county, there doesn't seem to be a whole lot in the restaurants and the bars, but it's more happening in social gatherings where families are getting together or people are coming in from out of town, and then somebody turns up positive later on, and then it spreads throughout the groups. So we are noticing one thing when we're doing the contact tracing is that when people are wearing masks, when they're at these kind of gatherings, as we're talking to the people that are confirmed cases, when we talk to the contacts that have been in touch with them, if they've been wearing the mask, people don't seem to be getting infected nearly as often as when people aren't wearing masks. So it's a little bit of a close to home suggestion that it really does seem to help and make a difference. So we just are really encouraging everybody to stay safe, wear their masks, keep away from large gatherings, and try to protect the elders and the people with chronic medical illnesses from getting sick, because those are the ones that can get some really bad outcomes. Thank you very much.